Addiction is a debilitating disorder that affects millions of people each and every year, and overcoming this illness can be much more complex than most people recognize. Although recovery from addiction is an unpredictable process, many addiction experts have taken notice to certain stages or phases every addict goes through on their path to sobriety. Hello everyone, I'm Dr. Anonit Sabharwal. I am a Delhi-based psychiatrist. I have a decade-long experience in addiction, mental health and sexual health. Let's talk about the stages of addiction recovery. While there are many ways to break down the recovery process into easy-to-digest steps, the most compelling was introduced by James Prochaska, Carlo Di Clement, and John Norcross in their 1994 book, Changing for Good. In this book, Prochaska, Di Clement, and Norcross have introduced the concept of 6 stages of change that correspond to particular phases in an individual's journey from active addiction to lasting sobriety. Let's talk about all of these 6 stages one by one. Before talking about the stages, bear in mind that this concept applies as much to behavioral addiction as it does to substance-based addiction. Now, stage 1 is the pre-contemplation stage. At this stage, the addict has become aware of the consequences of their addiction, but they're either minimizing them or justifying them. At this stage, defense mechanisms are in high gear and people are still reluctant to acknowledge that they even have a problem. They might be going through the motions due to pressure from legal trouble, strained relationships, or even financial trouble, but they will often look the other way. At this stage, addicts will typically avoid conversations around their addiction and also avoid people who bring them up. People in the pre-contemplation stage are not even considering changing their addictive behaviors. They may be in denial or believe that anyone who points out their problem is exaggerating. In short, the perceived benefits of continuing with their addiction are thought to be greater than the cost and repercussions. There are 4 main reasons for someone to be in the pre-contemplation stage in their addiction journey: reluctance, rebellion, resignation, and rationalization. Reluctant people in this stage may lack the motivation or knowledge about change, and the vision of their problem may not be in their conscious awareness. Rebellious people may have an investment in their addictive behaviors and making their own decisions. They do not like being told what to do, and that makes it harder for them to let go of their addictive behaviors. Resigned pre-contemplators have given up on the possibility of change and are overwhelmed by their addiction. Many of them have previously attempted to quit. Those who rationalize believe they have all the answers and will often reason it out with themselves over why they think their addiction is not a problem for them. Stage 2 is contemplation. At this stage, addicts have accepted that they need to make changes but are struggling to understand not only the root cause of their addiction but also how to move forward. Choosing to seek help is a huge step. At this stage, addicts may still be using their substances or indulging in harmful behaviors, but many report enjoying it much lesser, even if they are using more. They may waffle between wanting and not wanting to change. Procrastination or stalling is common in this stage. They may, for instance, decide that they want to seek treatment in the next 6 months, but will not set a definite date. It is also common for people at this stage to attempt to curb their addiction on their own or make plans about doing the same. People at this stage may be stuck for a long time, and that's because even though they're feeling that they need to make a change, they feel that they're not ready to act on it yet. Contemplation is an uncomfortable process, and feelings of guilt, shame, hopelessness, and desperation are common as people reach the crossroads in their addiction journey. The end of the contemplation stage is marked by simultaneous anxiety and excitement. Once people in the contemplation stage shift away from just thinking about the problem to thinking about the solution, they move towards the next stage of recovery. Stage 3 is preparation. In transitioning from contemplation to preparation, the addict realizes that the repercussions of continuing addiction far outweigh the perceived benefits. Moreover, he or she decides that the changes required to kick the addiction are attainable and also that there is a need for treatment, thus beginning the preparation stage. At this stage, the addict is fueled by excitement as he or she has already made concrete plans for their recovery. These plans may include a pledge of abstinence or admitting themselves to a rehabilitation facility. Regardless, these people have prepared themselves for a life sans their addiction, and they have more than just a vague idea of how they're going to achieve this. It is not uncommon for those in the preparation stage to report having to overcome feelings of ambivalence before progressing to the next stage. However, once they have committed to a plan of action, they are likely to move on smoothly. It is also at this stage that the addict now begins to accept help from family members, close friends, and other important relations. Just by choosing a day, month, or even a year to focus on recovery helps addicts to move on from the preparation stage on to the next stage. Stage 4 is action. In this stage, the addict has immersed himself or herself into recovery, either by enrolling into a treatment program, joining a 12-step program, or by utilizing some other type of resource for rehabilitation. The individual is committing to making significant lifestyle changes in order to make life healthier and more productive. In addition to the skills and strategies that the individual learns in this stage to remain abstinent, the individual also starts making fitness, dietary, and career plans, and repairing and re-establishing relationships. For many addicts, the first step in the action stage involves going through a detoxification process. Now, detoxing in a medically managed environment is always advisable, whether the addiction is substance-based or behavior-based. Once this detoxing is over, people begin work on the psychological, social, and behavioral problems that accompany their addiction. There are a host of treatment programs available, and they include short-term rehabilitation, long-term rehabilitation, outpatient services, individualized counseling, group therapy, and 12-step groups. Stage 5 is the maintenance stage. In this stage, the addict assumes responsibility for remaining abstinent. In other words, he or she must maintain the sobriety acquired during the action stage. Now, this is the most important stage out of all other stages, and that's because once an addict's time in a treatment program comes to an end, he or she will eventually go back home and be exposed to the same cues that brought about the addiction in the first place. This stage is not given its due importance, and that's why most of the people who relapse do so in the maintenance stage. Much like a skill or trade must be practiced after being learned, a person who is recovering from an addiction must practice life in recovery. Stage 6 is the termination stage. At this stage, the transformation of recovery is essentially over. Although recovery is a lifelong endeavor, an individual in the termination phase will have likely regained his or her health, has stable relationships, has a stable job or career, is financially independent, and is confident that he or she will stay in the same state. When asked, most people in the termination stage have no intentions of returning to active addictions and are relieved to not have the same habits as they did when they were addicted. Now, although some addicts move through the stages of recovery in a linear fashion, most do not. It's more common for people to move back and forth through the stages of change as they tackle addiction. Relapse is more the rule than the exception. In fact, 40 to 60% of people who are trying to quit end up relapsing. But that doesn't mean that the treatment has not been successful. Approximately 15% of the people who relapse regress to the pre-contemplation stage, and about 85% of those who relapse regress to the contemplation stage. On average, an addict will go through this cycle at least 3 to 4 times before completing the cycle without a slip. Some people recover faster and others take their time. Okay, that's it for today. I hope I've motivated you to take the next step and change. Thank you for watching the video till the end. Take care of yourselves.